Sometimes the greatest discoveries in science are not found where we expect them to be. They emerge from the shadows of failed experiments, a quiet whisper that something else is happening. This is the story of one such happy accident. It is about a medicine designed for one purpose that found its true calling in a completely different and very visible way. Many people believe this famous hair loss treatment was meticulously designed in a lab just for that reason, but that common belief is a myth. The real story begins not with a desire to grow hair, but with a pressing need to control the human heart. In the 1970s, scientists were locked in a race to find better ways to treat high blood pressure. This condition, a silent but serious threat, was a major public health concern. Researchers at a pharmaceutical company developed a new compound. They called it minoxidil. As the clinical trials for the blood pressure medication continued, a strange pattern began to emerge in the patient reports. Beyond the dizziness and other issues related to blood pressure changes, there was another, far more unusual observation. People taking the oral medication noticed increased hair growth. This was not just a slight thickening of the hair on their heads. They reported new, fine hairs sprouting on their faces, arms, backs. This condition, known as hypertrichosis, was an unexpected and initially puzzling side effect. It was an anomaly that could have easily been dismissed as a bizarre but unimportant quirk of the drug. At first, these reports might have been considered minor annoyances. For a drug meant to save lives by controlling blood pressure, unwanted body hair seemed like a trivial matter. However, the reports were too numerous and too consistent to ignore. Doctors began to document this strange phenomenon with growing curiosity. What was it about this specific molecule that was stimulating hair follicles all over the body? The question shifted the focus of a few researchers. They started to wonder if this problem could, in fact, be the solution to an entirely different and widespread human concern: baldness. They discovered that the drug was a potent vasodilator. This means it helps open up blood vessels. When taken as a pill, it did this throughout the entire body. The theory was that this increased blood flow was delivering more oxygen. Blood, vital nutrients, essentially waking up dormant or weakened ones and encouraging them to grow thicker, stronger hair. The mechanism was surprisingly straightforward. Hair follicles, like any other part of the body, need a healthy supply of resources to function properly. When this supply diminishes, as it can in cases of pattern baldness, the follicles shrink and produce finer, shorter hairs until they stop producing hair altogether. This drug appeared to reverse that process, not by creating new follicles, but by revitalizing the ones that were still there, but struggling. With a plausible theory in hand, the next logical step was to find a way to harness this effect without causing the unwanted side effects of the oral pill. Taking a systemic drug just to grow hair was not a viable option for most people. It could dangerously affect their blood pressure and heart rate. The solution was to apply the drug directly to the source of the problem. The researchers proposed a radical new delivery method, a topical solution. A cream, a liquid, applied directly to the scalp, targeting the hair follicles while minimizing absorption into the bloodstream. This idea launched a new wave of research and development. Scientists worked on a stable, effective topical formula that could penetrate the scalp and reach the hair roots. Early, small-scale tests on volunteers with male pattern baldness were promising. Participants who applied the liquid to thinning crowns and hairlines began to see new, fine hair growth within months. Encouraged, the company moved to larger clinical trials for regulatory approval. The goal was to prove to the U.S. Food and Drug Administration that it was safe and effective for treating androgenetic alopecia, or common pattern baldness. Data showed users had a visible increase in hair count and in hair thickness versus placebo. In 1988, the FDA approved it. The first medically proven treatment for hair loss was sold under a brand that became famous worldwide. The product launch was a landmark event. For the first time, a non-surgical, over-the-counter option existed, offering hope to millions of men and women experiencing hair loss. The market exploded. A surprising side effect of a failed heart drug had become a multi-billion-dollar industry. Other companies later produced generics after the patent expired, making the treatment more affordable and accessible than ever. The accidental discovery had become a global commercial phenomenon, all thanks to a simple change in perspective. The incredible story of this drug's origin has, over time, become tangled with myths and misunderstandings. The most common myth is that the drug was always intended to be a hair growth product developed through a direct and intentional search for a baldness cure. This paints a picture of brilliant scientists setting out with a clear goal and achieving it. While it makes for a simple narrative, it completely misses the more interesting, winding path of real scientific discovery. The truth is far more accidental and, in many ways, more inspiring. It shows how science progresses through observation and adaptation. Myth: this drug was invented to cure baldness. Fact: this is incorrect. The drug was first created and tested as an oral medication to treat severe high blood pressure. The hair growth it caused was an entirely unexpected side effect. It was only after this side effect was observed repeatedly that researchers began investigating its potential as a topical treatment for hair loss. The discovery was a classic case of serendipity, not a preconceived plan. The initial failure of the drug in its original purpose was the very thing that allowed its true potential to be found. Myth: the treatment is a permanent cure for baldness. Fact: this is another widespread misconception. The drug is a treatment, not a cure. It works by stimulating and revitalizing existing hair follicles. It does not create new follicles, nor does it permanently alter the underlying genetic or hormonal causes of hair loss. Consequently, its benefits are temporary and depend entirely on continuous use. If a person stops applying the treatment, the regrown hair will typically fall out within a few months, and their hair loss will revert to its previous state. It requires a long-term commitment. Myth: it works for everyone and restores a full head of hair. Fact: the effectiveness of the treatment varies significantly from person to person. It tends to work best for individuals in the earlier stages of pattern hair loss, particularly those with thinning on the crown of the head. It is generally less effective for a receding hairline or for people who have been bald for many years, as the hair follicles in those areas may be too dormant or gone completely. While some users see substantial regrowth, others may only experience a slowing of their hair loss or find that it simply helps them maintain the hair they still have. The story of this drug is not just about science. It is about people. Consider the example of a man named Sam, a graphic designer in his late 30s. He began noticing significant thinning at his temples and on the crown of his head. This change, while purely cosmetic, had a profound impact on his self-esteem. He felt older than his years and became self-conscious in social and professional settings. He tried countless shampoos, vitamins, diets that promised to restore his hair, but nothing seemed to make a difference. Feeling he had little to lose, Sam decided to try the topical hair loss treatment. He was skeptical, but followed the instructions diligently, applying the solution to his scalp twice a day. For the first 2 months, nothing happened. He almost gave up, convinced it was just another false promise. But around the 4th month, he started to see something remarkable. Tiny, soft, colorless hairs began to appear on the thinning areas. He continued the treatment, and over the next year, many of these fine hairs grew thicker, darker, longer, blending in with the rest of his hair. Sam's confidence grew back along with his hair. He knew it was not a magic wand. His hair was not as thick as it was in his 20s, and he knew he had to keep using the product every day to maintain the results. He accepted this trade-off. For him, the simple daily ritual was a small price to pay for feeling more like himself again. His story is a common one. For many, the treatment is not about achieving a perfect head of hair, but about regaining a sense of control and slowing down a process that can feel deeply personal and dispiriting. This powerful human desire for a solution is what fueled the drug's massive market success. Hair loss affects millions of people, and its psychological impact can be significant. The arrival of a scientifically validated, accessible treatment created enormous demand. Companies invested heavily in advertising, turning the product into a household name. This demand drove further innovation, leading to different strengths, foam-based formulas for less irritation, and versions specifically marketed for women. The journey from a failed pill to a billion-dollar industry was powered by a fundamental human need. The journey of this remarkable drug holds a clear and powerful lesson about scientific progress. It is a vivid reminder that science is not always a straight line from problem to solution. More often, it is a winding road filled with unexpected detours, happy accidents, surprising discoveries. The failure of this drug as a heart medication was not an end, but a beginning. It opened a door that no one even knew was there. This story champions curiosity and the willingness to investigate anomalies instead of dismissing them as mere errors or nuisances. This accidental discovery is a reality check on the idea of a cure. We often want perfect one-time fixes for complex biological problems. This drug, however, is not a cure. It is a management tool. It helps many people manage hair loss symptoms, but it doesn't address the root cause. Its success depends on consistent, long-term use. This distinction sets realistic expectations and shows that medical success can mean effective management rather than complete, permanent eradication. Applied to the skin, it is still a potent drug with possible side effects: scalp irritation, redness, itching. In rarer cases, excess absorption can cause dizziness or a rapid heartbeat, a faint echo of its original role as a blood pressure medication. This underscores using medical treatments as directed and remembering that over-the-counter does not mean risk-free. It's a tool. Use it with care and respect.